So I'm here with Dr. Eric Westman, an American physician. Welcome.
Thank you.
You do a lot of bariatric medicine with people who have a problem with obesity and using low carbohydrate diets, right?
Yes. So I work at Duke University Medical Center, which is in Durham, North Carolina, and I help people lose weight. That's my job now.
Yeah. And how did you end up doing that?
Well, many years ago when I was a young doctor, I had several patients as a general practitioner. I was a general practitioner. They lost weight on their own, and I was very curious about it. It turns out that they did a low carbohydrate diet, and so I sought out the people that were using low carbohydrate diets at the time. One of them was Dr. Atkins, and I asked him how it worked. He said that, why don't you come to my practice and look? So this was about 1998 or so, a few years ago. It was very interesting to see the practice, so I asked him if we could do some research. And so we helped start the research going on low carbohydrate diets about 10 years ago. And every study since then has been positive in support of low carbohydrate diets. So I use that today in my clinical practice.
So what kind of results do you see using low carb approach with obese patients?
Well, the results are nothing short of fantastic. When people come and start a low carbohydrate diet, the first thing you notice is that the appetite goes way down.
Okay.
People just aren't hungry, so it's almost like I'm giving them a pill to lose weight, but I'm not. All I'm doing is teaching them to eat certain foods and to stay away from certain foods.
Okay. So what kind of food should you stay away from?
Oh, right. Well, you want to stay away from foods that raise the blood sugar, because raising the blood sugar raises the hormone insulin.
Yeah.
And then insulin makes it so you can't burn your own body fat. It even makes your body make fat from the sugar.
Right.
So you want to stay away from sugars, starches that get broken down to sugars in our body.
And what kind of food should you eat?
Well, it's interesting. One way I teach the diet is that you should eat real foods.
Right.
Foods the way Mother Nature intended them, if you will.
Sure.
So that means foods that have protein and fat, and foods that are low in sugar and starch. An example in our area in North Carolina, lots of people eat eggs. They eat bacon, and so pork, bacon. They eat sausages. They can eat salads with vegetables and seafood, and really lots of different
Lots of good
foods.
food.
Delicious foods.
Yes. So your patients, do they enjoy eating like that, or do they find it hard to do? Or?
Well, what people say is it's a lot easier than they thought it would be. So while there may be an initial fear or reluctance, if you just try it, I say just try it a few days. And I see people in a clinic where they want to change their lifestyle. So after a day or two, they find that the appetite goes away. They're eating delicious foods. There may be some cravings, but I see people a week later to make sure that it's going well, and to make sure that if they're on medication, that the medications are adjusted accordingly. It turns out
what kind of medication adjustments do you see the need for most often?
the most profound effect is on the diabetes medicines.
Right.
People don't need the diabetes medicines anymore. So in as little as 1 week, I took someone off 180 units of insulin.
Oh, that's a lot.
Which is a lot of insulin.
Yeah.
So if you don't monitor people, the blood sugar might go very low, not because of the diet, but because of the medications.
Right. Have you seen any adverse effects, like people taking too much medicine combining with a low carbohydrate diet and getting hypoglycemia?
Well, fortunately, in my clinic, because they have my phone number, they have a way to contact me, I don't see that as a complication, but it might happen.
Never seen it ever?
The blood sugar may be low, but I tell people not to eat more, but to cut their medicine. So I teach them ahead of time. They may have been trained to eat some sugar.
That's kind of the opposite. If you compare it to the usual
traditional teaching
line by the doctors would be to eat more carbohydrates to cover all the insulin you're taking.
Yeah, that doesn't work well.
What's wrong with that line?
Well, if you have the choice of reducing the medicine because you no longer need it,
Mhm.
or just eating carbohydrate to take the medicine, I would choose to not use the medicine.
Yeah, so the lifestyle that makes you need the least amount of medicine is probably the right one.
Right. That's a good way to put it.
Hmm.
So avoid the foods that raise the blood sugar in general, so that makes it very good for diabetes.
And how about blood pressure and the medications for that and the
Well,
low-carb diet?
Again, the blood pressure gets better, and we need to reduce the medications. for
On
blood
all
pressure.
patients?
On just about everyone.
Really?
Yeah.
Wow.
It's pretty amazing.
It is, yeah. So the patients who come to see you, they usually take quite a few medicines.
Right.
I
Well,
saw.
5 to 10 medicines per person,
Yeah.
generally. We saw.
Generally, and
you
some
were in
people
my
even
clinic
more.
for a few
Right.
days.
Yeah, I did.
I hope you had a good time.
I did.
Um,
Thanks a
and
lot for that.
There were lots of medicines, and you saw some people get off medicines.
Oh yeah.
But the diabetes, hypertension, cholesterol medicines, they're no longer needed.
Really. So isn't saturated fat bad for the cholesterol? I'm just playing the devil's advocate here.
No. No, although we've been taught that.
Yes, we
So-
have, right?
We were taught the wrong thing.
And why is it wrong?
Well, our body needs saturated fats. So as a fundamental premise,
Mhm.
to restrict saturated fats makes no sense.
But we can build them ourselves, right?
We can make saturated fats ourselves,
Mhm.
right? But the nice thing about fats in the diet is that it makes you not hungry.
Right.
It's very satisfying, so you don't eat too much. I think the mistake of limiting saturated fats leads to a kind of a bizarre interpretation of what the diet should be,
Mhm.
to not eat meats or things like
Right.
that, which are healthy things to eat.
Right. Mm. Well, but the LDL level, the bad cholesterol, it might rise a bit on a low-carb, high-saturated fat diet, right?
Well, the clinical trials show that on average it doesn't change, but in some people it may go up.
Maybe just a little bit on.
A little bit. In many people it goes down.
Mhm.
But when you look in more detail at the LDL,
Right.
the LDL changes from the small LDL to the large, fluffy
Right.
LDL.
Yeah,
and that's a good thing.
And that's a good thing, right?
Yeah. Well, but if you look at the whole
So
panel,
how do you get the bad, small, dense LDL, would you say, most effectively by diet? How do you eat to get those? The dangerous ones.
to reduce the
Not to
dangerous
get,
small
if you want to
LDL,
have more of them, what should you eat then?
well, if you want to reduce the small LDL, don't eat carbohydrates.
Oh, yeah, right.
Eat more fats.
Exactly. Okay, so you met Dr. Atkins before he died.
Yes.
He was in his 70s, something like that.
Yes.
Yeah. So what's your impression of him?
Well, he was a brilliant doctor.
Mhm.
He was. The external view was very narrow because of the media things, and I went to visit him at his practice, and the diet was just one of the things he was using. It was the end of his career, and it was clear that the diet worked. He learned about it through research. That was one of the interesting things. He talks about how he learned about it through the medical journals back in the 1950s. And he was, I think, a bit frustrated because people didn't listen, or
Right.
they gave him a hard time because of the fat in the diet.
Right.
Even though it clearly worked when I
Yeah,
visited.
and then he lost a lot of weight doing the Atkins
Yeah.
diet himself.
Yeah,
In the
said that
60s, I guess.
he said that his first weight loss diet was shrimp, was seafood.
Oh, shrimp.
Yeah,
Okay.
and shrimp, the
Yeah,
seafood.
I know.
But
That's good.
and yet there's a misconception that it was meat, or steak.
All seafood? Was
I think it was shrimp.
He only ate shrimp?
Well, that's how the story goes.
For how long?
I don't know the details, but he had a voracious appetite. He
Yeah.
told the story of
Yeah.
having to ask for food when he was in line at the restaurant. So
Oh.
he was looking for a diet that would cut his own appetite out personally,
Right.
and then started using it with his patients.
Right, and it worked fairly well, you might say.
It did, yeah.
He had the best-selling diet book of all time, right?
Yeah.
And you've done an updated version of that,
Right.
together with a few other people.
Well, there were 3 other researchers over the last 10 years of researching low-carb diets. We talk about it, compare notes, and we found we were all Atkins advocates.
Right. Yeah.
So the company that sells the shakes and the bars, Atkins Nutritionals,
Mhm.
asked us to update